is reported, and Lirandzu, the minister, will then tell us that this scare and this tragedy involving over 150 deaths is now officially over.
Well, that amount, Jeremy, has actually escalated. We understand that about 200 people have succumbed to this deadly disease, but we also understand that officials have been able to put a lid on the Listeriosis outbreak. Just to give us more information is, of course, the Minister of Health, Dr. Motsoaledi. Thank you so much for joining us this afternoon. Minister, tell us about, you've given the green light to citizens to officially now go back to eating the cold meats, the so-called polonis and Viennas and Russians. However, you have also given a warning that listeriosis is not necessarily out of our shores as yet.
Well, what I meant is that the outbreak is over. The outbreak that led to the deaths of so many people. But I was reminding people that that does not mean the organism called listeria is out of our shores. It remains there in the environment, in water, in vegetation, as we have announced before. And all that we are saying is that we are back to our pre-outbreak days. Remember, listeria has been in South Africa for the past 40 years. And the NICD has reported that it infects about between 60 and 80 people per annum for the past 5 years. That was what has been happening. So we are just back to those days. We are no longer having a situation where lots of people, especially babies, were announced to be dying every sort of week. That's what we mean when we say the outbreak is over. It's like cholera. There's been cholera outbreaks in the country. For instance, the last one was in 2008. It's over. But it doesn't mean the organism called Vibrio cholera is no longer there in our shores. If something happens, something happens that encourages it, it will flare up again. It's like Ebola. The fact that in West Africa there's no longer Ebola outbreak does not mean that the organism is gone. That's what I meant.
However, Minister, there has been lessons that you've been able to learn from this outbreak that claimed about 200 lives, and one of them is the fact that there needs to be stricter health, policies that need to be put in place. Tell us more about what is it that is going to be done by the department, by health officials, to make sure that this doesn't occur again.
It's not only health officials. I'm sure you are aware of outlined here that for any foodstuff to be eaten, there are many departments that are involved, starting with agriculture at the farm level. Then you go to the Department of Trade and Industry, municipalities certifying in terms of bylaws that a particular premises can produce food. Then you have got the National Consumer Commission. So it's all those departments. And all of them were working together. So one of the things they've done is to strengthen food control regulations under the guidance of the World Health Organization. And every food producing company has been instructed to produce a plan, because even the companies themselves have got responsibility over consumers. It's not only the state that takes that responsibility. If you produce food in terms of the Consumer Council Commission, if you produce food as a company to give it to people, it's your responsibility to make sure that you produce safe food that will not harm the people. So they've been given instructions on what they must produce, otherwise then they won't qualify to produce food.
We also understand that there's been about 900 inspectors that have been educated as to how to test for listeriosis in the 150 plus warehouses that do sell meat. But let's just go to another point that you did announce on this morning, Minister, which is with regards to what we've seen so rampantly on social media and everywhere else, where it's alluding to fake foods. You have sent out an appeal to the public with regards to fake foods. What have you been able to ascertain with regards to your investigations?
Well, Lirandzu, this was the second press conference I held today. The media statement from social media has been reporting finding fake foods, very funny type of thing, rice made of plastic, bread that does not dissolve in water and all that. So, and they believe the government was doing nothing. So I was reporting what we have done. We got this information in July. On the 8th of December, the Chief Director of Environmental Care in the Department of Health wrote to all the 52 district municipalities and metros in South Africa, asking the environmental practitioners to go and inspect all over the country, foodstuffs and in food selling facilities or facilities that handle food. That's what we have done, and we did so because the people in the past who used to be called health inspectors, who are now called environmental care practitioners, are resident in municipalities in terms of the law. So we have been workshopping them, but we told them to go and inspect. And as of yesterday, 12 of them reported. Some are metros, others are districts. I can't remember their name by offhand. So what they found, yes, they did find expired food. They did find food with the wrong sell-by dates. They did find premises that are illegal, meaning they are producing food, but municipality bylaws are not being followed, or they were not given certificate of compliance. You don't just open a food selling or producing facility in a particular municipality until they give you permission to do so. So they found those and they've closed them down. The National Consumer Commission, working with many other structures, including SEPS, has also done that in Tshwane. What we did not find, however, is something called a fake food. In the sense I've mentioned, food made, rice made of plastic, bread that doesn't melt in water, food that causes this and that we saw on social media but have not been found, at least in these 12 municipalities. And in the raid done by the Consumer Commission, together with companies that are being affected by counterfeiting, they went there together, they didn't find anything. The only two things that were found, which have been established by police, not even by us, because it was criminality, was a factory in Johannesburg producing what they called clean water through bottled water, and they're using the name of Valpro, which is not true. And then in Hartswater, a factory that was producing spices using the name of Robertson. We know that Robertson is the main spice producing company, well established, well registered, but they used their name and it was false.
So no bread that, as you said, is not dissolving in water and so forth. So what you're saying is that
never found, and we are appealing to people to bring us. Even in the media, Lirandzu, more than 2 weeks ago, some media houses have told us that they are going to buy those goods and bring them to us. We've been eagerly waiting, and we're still calling them over to come, and we're saying anybody who can come across such a fake food stuff and buy it, will reimburse them regardless of what they buy it for. They must give us a proof that I bought it for 200 rand or they must bring it for our scientists to test, because the government cannot rely on pictures on social media. And we are saying anybody who takes that picture, it means you took a picture of something.
And it should be there, and it should be there.
It should be there. They should bring it. They mustn't just say, no, there's a factory somewhere. There is a gentleman who phoned us.
Unfortunately, Minister, I have to wrap it up, but thank you so much for that information. A clear message that people that do have this sort of food products that are suspected to be fake, they should come forward. Thank you so much for your time.
Thank you very much, Lirandzu.
That, of course, is the Minister of Health giving us an update on the two very critical issues that he reported on this morning, of course, being fake foods and the fact that health officials have been able to put a lid on listeriosis. Over to you.
All right.